guys last week when that was 2 weeks ago. I told him, this is what I want. Yeah, he did it before, you know. I don't think he just went out one ear, went out the other. Then he did it his way. So,
but it looks very professional and good.
Thank you.
Yes.
I told him, this is what I want. Yeah, he did it before, you know.
That's weird.
I don't think he just went out one ear, went out the other.
We're on a,
We are live.
you're on a 3-minute delay though, or a 3-second delay.
Yeah, it is. Okay, I got 9:30, John. Okay. Good morning, everyone. This is 9:30, and we are ready to start the Health and Human Services Committee meeting. It's Wednesday, April 13, 2022. The first thing on the agenda would be public comment. And I see we have guests here. Come on up front if you would like to talk. We're going to have public comment one more time in this meeting too, and that's at the end.
Okay, I'm Terry White here from Robinson Township. I'm just building a little bit upon what I addressed the committee about yesterday. And this Health and Human Services Committee looks like that is receiving reports in January from a coordinating council, goes by Human Services Coordinating Council. Does this mean that when they come and report to you guys, that this is an employee coming up to the county to report on a council that they're on? I find nothing about this in open source. What does this council work for on the county, and where do I find it? That's what I'm asking for. Thank you.
Okay, I guess I'm opening it. I'm not opening up, but somebody will get back with her. I can't.
Well, and again, we have Patrick Sisler here from Community Spoke anyway, and maybe when we get into the discussion items, we can have when Patrick gives his update on Community Spoke, he can give a brief description of Community Spoke's role and the fact that he's not an employee of Ottawa County.
Okay.
Okay, can I ask a question when that time comes?
Yeah. Okay. Well, I'll ask that question. One question.
It's the same question.
Okay. Okay. Any other public comment? Okay, then we're gonna go the consent agenda. Do we have we got a quorum, don't we? We got a quorum. Can I have a motion to approve of the agenda?
So moved. Randy.
Support.
Thank you, guys. All in favor of it, say aye.
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 And now we're going to have approval of the proposed minutes for February 9. We did not meet in March, so we're going way back to February. Do I have a motion for that?
So moved.
Support.
All in favor of it, say aye.
Aye.
Aye. Motion passed. We're going to go to action items. There is none. Discussion items. Hearing and Vision Program update. Leslie Verdine, Public Health Team Supervisor. I believe Leslie is in the audience and she's making her way up. First, I thought you had a bowling ball.
Good morning. I'm being very careful with the supposed bowling ball. It's very expensive. I am Leslie Verdine, and I am the Child Health Team Supervisor for Hearing and Vision, as well as the Elevated Blood Lead Program and Children's Special Healthcare Services. And it's good to see you, and congratulations, John. Nice to have you on board officially. So what I wanted to give information about for the Hearing and Vision program this morning, is an overview basically of the last 3 years, because I really believe it paints a picture on how the pandemic affected our whole department. But I realize the numbers are the Hearing and Vision program data. And as an essential service of the public health department under Michigan Public Health Code Section 333, parts 9301 and 9305, we have worked hard to serve our communities over the years, and we're happy to get back to screening, our children and help ensure their learning capabilities. A short story about how this program can affect many systems in Ottawa County. I had a conversation with a local first grade teacher in Ottawa County who asked if hearing and vision screenings would be available for her students soon. And this was at some point, I believe in 2021. She was trying her best to work with some of her struggling students in reading, but realized they could have many different contributing factors to their struggle on learning how to read. Could they hear their teacher's instructions? Could they hear how to form the different sounds of their language? For example, in the English language, a person needs to accurately hear the TH, th sound, as well as the F and the S sounds. They have to have their hearing intact at the 6,000 hertz range. And these sounds are typically heard at 15 decibels. Only birds flapping their wings require a more sensitive level of hearing at that range. Or could the student be on the autism spectrum and would benefit from different forms of therapy and need to start that soon? Or their problems at home that manifest in emotional problems at school and their inability to absorb the learning? Or do they have a cognitive or developmental disorder that they need further professional help? Or could it be that they couldn't see the board at school? Or they have a convergence insufficiency issue or dyslexia? The teacher explained that if she could just get confirmation on at least two of those possibilities that could complicate the reading, such as hearing or vision, they could rule out at least those possibilities or even fix their issue completely, possibly, so that they can move forward in their education much more quickly. So having hearing and vision available in the schools is very important. She missed having the assurance of at least her students' ability to hear and see. So the education system's been affected, students and teachers alike, the family life, and what does the student's future look like if their vision loss becomes permanent, which is usually by age 7. This condition is termed amblyopia, and it's all too common. Our screening numbers over the years, just in a review, since 2019, I kind of took a snapshot. So pre-pandemic, looking at just the months of March and April. In March of 2019, we screened 1,955 children. And that included preschoolers and school-age children. In comparison, that same month of March in 2020, we screened 718 students.
What was that? How many?
718.
Okay.
And that was just before the announcement of the COVID-19 school shutdown on Friday, March 13th, 2020. The technicians turned their work into finishing reports, letters, paperwork, and then helping make our older paper files into electronic records, and turned to helping in the needed COVID response work too. Then in 2021, again, the month of March, able to screen 567 students. So we still weren't where we wanted to be. However, please note in March of 2021, those were all preschoolers that we screened, and no school-age children were able to be screened, as all the technicians were working in the needed COVID response work, and at least part-time, if not full-time, in COVID response. By mid-2021, we lost 2 of our trained hearing and technicians. We have 5 total, plus me offering a smidge of help too. They were all doing COVID response work more than ever. We unfortunately followed the trend of losing almost a quarter of our technicians, no longer working professionally, to screen statewide.
May I ask you a question now? Do you know why we lost our technicians? Did they go someplace else, or did they just not want to be in the workforce anymore for a while? Or do you ever know any of the reasons why?
For statewide, I'm not sure.
Okay.
For us, it, I believe, was partially not wanting to work in the COVID needed arena of what we would have to do. So the world just completely changed for what they were trained to do.
Someone moved their cheese on them. Okay.
Definitely.
Yeah, just to add to that, we did.
I don't want to interrupt you, but
yeah, we did lose a little more than 20% of our workforce during the response period. in just in public health. And it was a variety of reasons. Some were what Leslie is describing, some had better opportunities, some retired.
But because they didn't enjoy the job anymore.
Right.
Yep, we all are.
So like I said, I think the hearing and vision program alone really spells out, it shows what happened to public health too. Our 3 full-time technicians and our part-time hearing and vision clerk spent the majority of their working hours in COVID response, but we had 2 technicians carrying the bulk of the screening of the children when possible, which led us to focus on the preschool children in the classroom settings in order to effectively screen as many as possible. Our clinic buildings were not open, so having parents bring their child to be screened was a faint memory of what we used to offer. In April of 2021, the technicians screened 158 preschoolers for hearing and vision. And again, no school-age children were screened that month. So compared to a dismal 2 school-age children being screened for hearing and vision, but none in the April of 2020, the 1.5 FTE technicians were working as fast and furious as they could. Looking back at 2019 in April, again, there were 2,963 screenings pre-pandemic. I am happy to report that we were able to hire 2 new 0.8 FTE technicians who completed their training successfully in a revamped virtual fashion, learning mainly for one of our full-time technicians not involved in COVID response in 2021. And also instrumental in helping us screen and train our new technicians was bringing back one of our retirees, our very own, back to work part-time. Very helpful. Thank you for approving that. We are happy that our full team is on board screening, as our last 2 technicians working COVID response were able to return full-time to hearing and vision starting this January. While they had been out of work doing the screenings for almost 2 years, they jumped wholeheartedly back into the swing with the team. I'm happy to announce in March of 2022, we screened 3,775 children. And this was 211 preschoolers, 1,917 students screened for vision, and 122 preschoolers and 1,525 students for hearing. So it really, just putting it all together, over 3,000 students screened for either hearing or vision. Already this month in April, we've conducted 655 screens by yesterday, April 12th. And I'm sure there's a few more that still need to be charted as they're scrambling in the schools all day. And though we had to make the tough decision to focus on preschoolers and elementary age students primarily this year, a large majority of our elementary students will receive their screens this school year. Monthly clinics are open at all our public health buildings again, and 76 profiles for open clinics this summer have already been planned and they're in the books. So I had mentioned the concern of catching amblyopia, which results in permanent vision loss at an early enough age to avoid permanent vision loss. One new tool we were able to purchase last year was, and it's receiving a lot of praise for the newest technology, is this Blink digital screener. It's designed to look further back into the child's line of vision where it focuses on the retina. And it's specifically designed to catch children for problems with amblyopia. It does catch measurable strabismus, visual acuity 20/40 or worse, and then that refractive error that could result in amblyopia. So this is our Blink machine. It takes about 5 seconds to scan a child. So it's super fast. If we get it down faster, I think it gets down to 2 seconds per child. It may look like a bowling ball, but it's very handy in making sure that we're catching those kids if we can't get the traditional vision screening on them. So especially for the younger children, and for our children with developmental disabilities or physical disabilities that can't answer questions when we're doing our vision screening. Would like to get another one someday, but
Okay. Do all, and the question is, all kindergartners, are they required to go to school that they have a vision test or a hearing test?
according to public health code, yes, they are supposed to have this done. It doesn't necessarily have to be done by our department. It can be done by doctor, own physician if they offer that. Last year, sorry, in 2020, the state kind of went back on that, realizing that our technicians weren't even available. And they did tell the schools, if they don't have it done yet, we'll figure this out in subsequent years. This year in 2021, we are screening all kindergartners for hearing and vision while they're in the school. Typically, we're only screening them for hearing. So we've also really doubled down on our work, trying to get these numbers done. Screening kindergartners are difficult and it's fun. A laugh a day, let me tell you.
So it is a state law that every kindergartner needs to have a vision and a hearing test. Okay. Right. And yet the state said, well, yeah, we're gonna.
They waived it for a period of time during the pandemic response.
And it does, so the schools get the reports from the parents or from our department when we screen them, and they enter it into the MICR program, which is the state database. It's also hosts immunization records, newborn hearing screen records, and lead level records.
Okay.
I have a quick question. Although the kids that were missed in the 2 years, I assume they are getting caught up now. They're being screened now.
Yes, like I said, we're getting to all of the districts in Ottawa County except for one this year. But keep in mind, we had one technician full-time from September till January instead of 5. And then we had to train 2 new technicians. So we're finally fully staffed, but there's no way we're going to make it to all the schools. I talked to other counties, they're in the same position, unfortunately. So that's why we're really trying to open up a lot more clinics this summer too.
Okay, so the school that you're not getting to, the district, are they aware of that?
Yes.
Okay, so they can make their own arrangements if they have to.
And like I said, the parents can choose to take their child into the doctor.
Yeah.
What I have seen in the few years I've done this is the parent often doesn't even realize or recognize their child has a hearing or vision problem. We had one youngster come in last year for a vision screen before he started kindergarten. He couldn't see anything. He had cataracts in both eyes.
Ooh.
So he needed surgery and the parents didn't even know. So
the children just adapt.
The child doesn't realize they can't see. That's their reality.
Yes. Oh, okay. Okay.
Any other questions?
To answer Kyle's question, I think the plan too is for that one school that we aren't going to get to, they'll be on the front end of the school year next year.
We'll
so
start
not that
with
we're not going to get to them. It's just that there's only so much time in a school year. And so they'll get moved to the spot number 1 for the 23
Thank
school
you, Lisa.
year.
True. They're the first school district we will start with in September. But keep in mind also, we're doing the hearing and the vision while we're in school for the kindergartners.
Okay.
First grade will get vision. 3rd, 5th, 7th, 9th grade typically gets the vision services. And then for hearing, it's kindergarten, 2nd and 4th. So it's not that we'll never touch base with them. And of course, the sooner the better, as I've already explained. But yeah.
Leslie, thank you so much.
Thank you.
Any other?
Al, it's Randy. I got a quick question. On the device that you're holding in your hand there. Okay, so they actually go up and they look into that device, or is it something they just look and read something, or is it read the eye? I missed that exactly.
How does it work?
Yeah.
So when I used it yesterday, I had the child sitting in a chair and I was about 2 feet away, 3 feet away. And I asked them just to look into the ball. There's actually a smiley face in here that they can see. And I tell them to look for the smiley face.
Okay.
So one eye at a time?
No, it'll do both eyes. It's a little bit creepy because there's a red dot and I have to line up the red dots. appropriately for it to capture what it needs to see.
Okay. Okay.
So the child doesn't know that.
No, but the
we get to see.
technician does.
Right.
Okay.
You know, and I don't even know if this exists, but when I'm looking at it, just as a thing that would really make it neat for kids, is if you could get a wrap or a decal around that to make it look like that. And I don't even know the name, but on Star Wars, there's that little that ball that rolls around. Okay. And the kids would just love that because they would think that's so cool. Okay?
Exactly. And, you know, and thinking of different ideas like that would be great. A lot of our younger kids don't know Star Wars, which is really sad, but something along those lines would be great. But I do need them to look in the center of it. So.
Sure.
Good. Thank you, Randy.
All right.
Any other questions or comments?
Not for me. Thank you for coming.
Thank you for your support. We really appreciate it.
Okay. We go to that department updates, and we're going to start right away with Patrick. Are you okay with that?
Yeah. Can you hear me fine now?
Yeah, Ken.
Great. Well, thank you. And so I'll introduce myself. I apologize I can't be there in person today. My plans changed kind of last minute. So hopefully everyone can hear me. And Terry, I believe that was her name, who spoke for public comment. So my name is Patrick Sisler. I serve as Executive Director of Community Spoke. And I'll just give a brief overview of who we are, and hopefully that will answer any questions you have. But then what I'd offer up is either Lisa or Lynn or John, you all have my contact information. If Terry would like to follow up and have a phone call or email correspondence, I'd be happy to chat with her more about it. But Community Spoke, we are actually an independent 501c3 nonprofit organization. So we were created out of a collaboration between Ottawa County and the Lakeshore Nonprofit Alliance, really with the mission and focus of strengthening collaboration between government and nonprofit organizations. So we do coordinate a human service, we call it Human Services Coordinating Council. It's a bi-monthly meeting of local government and nonprofit leadership. So including some of the folks in the room, public health, community mental health, DHHS, but also local nonprofit organizations like Good Samaritan Ministries and Community Action House and Evergreen Commons. And really our focus with that is to keep each other up to date on what's going on in one another's worlds, major changes, leadership, funding, programmatic, and really look for opportunities to collaborate. And so over the years, we've helped to facilitate collaborations around mental health and food insecurity, affordable housing efforts, most recently helped to address some of the human services needs created with the onset of COVID. And so we're not dedicated to any one specific human services need, but really kind of try to address what we feel are some of the most pressing needs. So I believe the other question was, am I a county employee? I am not a county employee. Again, we are an independent nonprofit organization, but obviously we work very closely with the county. As you know, we see them as key partners in this work. So again, hopefully that explains a little bit, but again, I'd be happy to have any more conversation offline about who we are and what we do. So beyond that, I don't have a major update today for you, Al. I think similar to when I spoke last at this group, we're kind of coming out of a lot of this COVID response and vaccine response work in the last couple of years, and are now looking, have the opportunity to be a little more forward thinking in terms of the activities that we're taking on. And so some of the key conversations we've been having as a leadership group revolve around, how do we position our community, knowing that a lot of this influx of federal funding that has federal and state funding that's come in the last few years, what happens when that begins to recede, which we know there's some dates and timelines on a lot of the benefits that we've seen and a lot of families have been benefiting from. What happens? How do we prepare our community to get out in front of that? For example, we've had a housing eviction diversion funding that has helped keep a lot of families in their homes in the last 2 years. That funding is not guaranteed forever. And so what does that mean for those families when that funding goes away? How do we work with our partners to help prepare the community for when that happens? And what does that look like when it comes to food benefits? for example. So we're just on the front end of a lot of those conversations. That's taken up quite a bit of our time right now. The other thing I'll just highlight, just because I know they're also a key partner in a lot of the collaborative work we do in the county, that the United Way, I'm sure many of you have heard that Patrick Moran, who was the president there, has moved on from his role. And so we are actually helping to work with their board of directors on hiring a new president, CEO for the United Way. So normally I wouldn't mention that, but again, I know how key the United Way is to a lot of our collaborative work. So just wanted folks to know that that is taking a significant portion of our time as well. So happy to answer any questions about anything else at this time.
Randy or Kyle, got any questions for Patrick?
No, I am all set.
Nope, I don't. He does a good job.
Okay. And John, I'm going to touch base. Is the county involved with the United Way picking a new CEO?
No.
Do we have anybody on the board at United Way?
I don't believe so.
Okay. I'm just a little curious.
No.
And I know I'm not going to speak out of turn here, but I hope Patrick answered some questions. My next statement is if they have more to contact you. Okay.
Yeah, and as Patrick said, if they have more questions, I can provide Patrick's phone number and email address, and they can reach out to him directly.
Yeah, I think that's the best way, right? Okay.
If I can, Al, sorry, if I can share one more thing, just if Terry still is in the room, if there's a specific like human services need or request or want to learn, make a connection with another human services organization in the community, I'd be more than happy to make that connection. Again, that's part of what we do is make connections between government and nonprofit partners. So I just offer that up, but happy to help.
Could you wait until public comment? Okay, that's one more time. We're going to go to Dr. Gwynn.
So Patrick, maybe you can just hang on till the end of the meeting for the second public comment.
Yep. We're going to Dr. Gwynn.
All right. So I know that Doc Heidel used to do his disease of the month presentation, and I hope it's not disappointing. I don't have any gross pictures or anything to show, but I want to talk, I have a little bit of a different spin on the disease of the month. Last week, I was able to attend my first in-person educational conference since the beginning of the pandemic, and that was the Wisconsin Health Literacy Summit in Madison, Wisconsin. And so today, my disease of the month is actually more a risk factor for disease, and that is low health literacy. So health literacy, you may or may not have heard that phrase. It's my favorite area of study. And there are a couple of different ways of looking at it. So the National HHS Healthy People 2030 goals include improving health literacy for everyone. And so what does that even mean, right? So it used to be that we defined health literacy as the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Straightforward, right? Okay, so if we're talking about literacy, that is a whole mouthful of words, right? So when I first got into the health literacy area of study, it was all about helping patients understand, helping them understand their illness, helping them understand what their risks were for illness, and then helping them understand what they needed to do about it. But if you look at that definition, it talks more about the individual's responsibility. And if someone is already sick or having struggles, like that's a lot of burden to put on them, right? So the new definition includes organizational health literacy, and that is the degree to which organizations equitably enable individuals to find, understand, and use the information and services. So that puts more of the responsibility on those of us providing the information and the assistance, and this fits perfectly into our Healthy Ottawa plan, particularly surrounding access to healthcare. So if you've had a chance to look at the summary of the Healthy Ottawa plan, health literacy is a big one right there in our face. So just a couple of numbers here. 20% of our underserved adults in Ottawa County are not very or not at all confident in navigating the healthcare system because it's so simple, right? 80% of our, what we would call, I guess, normally served adults say that they're confident filling out medical paperwork, compared to only half of our underserved adults that are confident filling out medical paperwork. And then 3 in 10 of our underserved adults in the county say that they at least sometimes experience problems learning about their health condition because of difficulty understanding written information. So it's an issue that's out there, and it does have a big effect on how people learn about their health, access the healthcare system, and really just understand how to navigate this complex system that we have. So one of the things that we're doing at the health department is really just kind of looking at everything we do through that lens of health literacy. How can we make this more accessible, more understandable, whether that means paying more attention to translation services for folks that don't speak English or read English as their first language, whether that means just having more understandable patient education flyers. Like, I've read through some of the stuff that we hand out in the clinic, and it's complicated. And so we're looking at revamping some of those things, but just really taking that responsibility on ourselves as an organization to provide that information, because one of the speakers at the conference last week said this, and I feel like I've always known this, but hadn't really put this into words, that health literacy is a modifiable risk factor. So we think about what are the other risk factors that we can modify. We can modify our diet. We can modify our activity level. We can modify whether or not we take our medicines regularly, right? That's all what the individual has to do. We, as the organization, can modify that risk factor by making sure that we are making information understandable and accessible for everyone, no matter what their level of English proficiency or education or understanding of health is. So I'm super excited about some of the partnerships we're starting up. I was able to meet with Heather from Great Start Collaborative earlier this week. We have all kinds of wonderful, lofty ideas that are right now just in the planning stage, but stay tuned for a little bit of an update on our disease of the month, low health literacy, and how we can modify it.
Thank you. Randy and Kyle, any questions for Dr. Gwen?
None here right now.
None for me.
I got one, and Lisa probably knows. Back in 2017, 18, 19, Dr. Heidel would monitor deer ticks or dog ticks like that. I remember we'd be talking about 15 minutes because it was serious. Anything west of 31 was high. I know that COVID took precedent over all of that stuff, but was anything monitored with the ticks last year, or do we?
I can answer that.
Okay.
Yeah, sure. So we do know that the rate of Lyme disease cases has gone up, which Lyme disease is caused by the bite of a deer tick, and if untreated could lead to some serious health consequences. We, for the last 2, probably 3, maybe even 4 years, have received grant funding from the state of Michigan to monitor the ticks. And that's what Dr. Heidel was talking about.
Okay, yeah.
So we hire a summer tech person to go out, and they do tick, like literally they take a white blanket and they drag and they pick up all the ticks and they collect them, and they're sent in to see if they have Lyme disease. Okay. And so we know we've been notified that we're getting another grant for this summer. We'll be doing the same program. We also, it's one thing to collect and find out that it's out there, but then it's a whole other thing to do something about it. And so this is where our partners are so important, because we're just, 100 people on James Street, right? We have to engage the community in identifying ways to educate using words that people understand about the risk of Lyme disease. We've partnered with parks and other areas where we know people are outside and can be exposed to these ticks. We want people to be aware of it. We're going to be doing more of that again this summer. So,
okay, thank you. You
yes,
answered my question.
Excellent.
But anyway,
probably gave you a little more than you wanted to know.
No. I'm still wondering that because every now and then my grandson, he had one in his head.
Yeah,
you know, and they don't know how long it was there.
Yeah, right.
So,
Yeah.
I know. Anyway, if there's no more questions for Dr. Gwen, Lisa, you're up.
I'll keep it quick. Organizationally, as we've talked about, we're transitioning out of what we would call that intense COVID response space. It wasn't like we weren't doing anything else other than COVID, but it did chew up a lot of our resources, to be honest with you. We're catching up on things like our hearing vision screens. We're taking in more people in our clinics for immunizations and family planning. We're monitoring other communicable diseases, which we have been all along, and we're starting to see some upticks. We've had a few cases of salmonella and some other things that we're watching closely in our community. We also are investing some time in looking back over the pandemic period, and we have a responsibility to do this whenever we've gone through an emergency. We're like law enforcement or fire, we have to say, okay, what worked, what didn't work. And so we're internally doing some analysis and conversation going through each phase of the pandemic to figure out, what could we do better if this happens again? And we're also going to be engaging some of our community partners in this conversation. We want to hear what their experience has been and how we could have done a better job to support those community members and community partners who were also responding during the pandemic. Which brings me to one point. We do want to get some feedback from our board, and there's a couple different things that we can do. We know that we can't have a personal conversation with everybody, so we're thinking about putting together a survey, which will go out to our community partners, and Patrick through Community Spoke is going to be really instrumental in helping us to make those connections. We could do that with the board too. We are going to take a few community partners and have some face-to-face. We could do that same approach with the board. We could have small group meetings where we could get feedback, ask some questions, and learn from your perspective. So I don't need an answer today, but would love for the Health and Human Services Committee members to provide us with feedback on how you think you could best speak into that space. Do you want to have conversations, or do you just want to do a brief survey? That report will be created, it'll be submitted to the state. Other departments and organizations are doing the same thing. Again, the sole purpose is to learn. Everything came so fast and furious. There were so many systems at play at the federal, state, and local level. There were things that were completely out of our control. There were things that were in our control. We know that with a new disease like COVID-19, there were plenty of opportunities to learn along the way. And when we're very committed to doing that, because we want to truly do the best job possible to serve our community. So more to come on that.
So you're just looking, Lisa, for some feedback from the committee as to whether the board wants to kind of do its post-action report, after-action report via survey, or if they want to have a series of meetings with you to provide feedback. So that's something, you know, Al and the rest of the committee members might want to give that some thought and see how you want to do that.
And you know, obviously you have a lot more interaction with John on a daily, weekly basis. And so John and I can work on whatever you all decide. You can communicate to him.
Lisa, in a snapshot of that, what you said, would you email the 5 commissioners that are on this board?
That question?
Yeah,
absolutely.
Okay, so that way I can send it out to the other ones too and say, let's have a dialogue or talk a little bit about it. So you better copy John on it too.
Okay. Other than that, I do want to mention too, the youth assessment survey results are out. There's going to be a presentation on April 25th. Anybody on the board, you should have gotten an informational email on that. you will have to sign up in order to get in. So if you want to attend that meeting, please do that. Working on a clinic remodel, which is kind of exciting because, oh my goodness, the clinic rooms are probably 35-ish years old. Not quite that old, but we've been limping along, and I think that it's time, and we really appreciate the county, you all supporting that remodel. We did the other part of the building remodeled just prior to COVID, and now it's time to update that clinic services area. So we'll get you in there for a nice tour when it's all fancied up and can accommodate our patients more appropriately. So that's all I have for today.
Any questions for Lisa, Randy, or Kyle?
Yeah, I guess my only thing is the report that you're going to be doing about the pandemic. Could we just do it like an annual report type style for the full board, so that everybody just like so you're not doing multiple little meetings or with the board members? It's just a one-shot thing.
Oh, to obtain feedback.
Yeah.
Yeah, we could do that. I'm going to leave that up to you, Kyle, to discuss with the rest of the members. I'm open to whatever you all decide would be the best approach.
Okay.
So Al, maybe just as chair, as you get feedback from the rest of the board members, let us know how you want to do that.
We're going to do that. We'll do.
And I'm good, Al. I'm all set.
Okay, thank you, Randy.
Yep.
Lynn.
Hey.
You're on.
Thanks. So we continue to be really busy. That's a good thing in a lot of ways. People are asking for help and support. It's a little concerning because there are so many people out there who feel like they need that level of mental health treatment and support. A lot of that has to do with COVID in the last couple of years. Particularly children is where we're seeing the most requests for services. We have hired some new staff, so we're trying to stay on top of those demands for services. I've told you in the past couple of months, we've received a few grants over the last couple of years, and one of the biggest ones is our SAMHSA CCBHC grant. So all those initials stand for SAMHSA is Substance Abuse and Mental Health Services Administration. CCBHC stands for Certified Community Behavioral Health Clinics. And that grant is helping us do quite a few different things. Primarily, it's intended to help us better integrate physical health and mental health. And it's allowing us to provide quite a few more health and wellness opportunities to the people we serve. One particular area that we're also able to hire some new staff and do work on is we call them our Navigator Positions, and they're part of our access center. And what these staff can do is more quickly address people who are requesting some sort of mental health services. It allows us to see them more quickly and talk to them more quickly than we might otherwise if we didn't have those staff. And it gives us the ability to do some short-term solution-focused counseling and get them pointed in the right direction. If it's our services, we'll obviously do that. But if it's things that they might need in the broader community, we're able to connect them to those services. So I think we hired our last Navigator position a couple of weeks ago. So that team's actually going to be fully operational in the next couple months once we train people. So that's exciting. It's a nice way for us to respond quicker and more comprehensively to requests. I'll let you know that we had so the Michigan Department of Health and Human Services is the oversight body for the public mental health system. there's been a pretty significant reorganization that's happened in the department in the last month or two. We are now under a program called BP HASA, more initials for you. So BP HASA stands for Behavioral and Physical Health and Aging Service Administration. I know lots of words. What they're promising is that once again, there will be better coordination between behavioral health and physical health. And I think there will be more oversight and administrative direction, which is not a bad thing. So there's lots to be learned about that reorganization. They're slowly but surely letting us know how that might impact us. So I'll keep you up to date on that. And the last thing I'll tell you, I think I mentioned before, but at the regional level, the Lakeshore Regional Entity is our oversight program regionally. They were contracting with an organization called Beacon Health Options to do some administrative functions, managed care functions. And the decision was made a couple months ago that that contract was going to end. So as of July, Beacon Health Options will no longer be contracting with the Lakeshore Regional Entity. All those duties and responsibilities are coming back in-house to Lakeshore Regional Entity. So that's a pretty significant change that the Beacon has been contracted with for, I think, 3 years as a result of some of the issues the region had been having financially. Things are looking much better as far as that's concerned. So I think this is actually a move in the right direction. So happy to answer questions. If not, that's all I have.
Randy and Kyle, any questions for Lynn?
Nope, Lynn, thank you. I don't have any at this time.
Nope, I got nothing. Thank you, Lynn.
Okay. Okay. Department updates, we're done with that. Public comment for the second time of the meeting.
Teresa White again, Robinson Township. Both my questions yesterday and today got answered. Yesterday's question was about the partnership that's written on the website. So, and it's as far as I can see, what he's saying is that it's a collaboration, not necessarily a written partnership. So that is answered. The other thing is answered is he's not employee. So it's my concern more is at the county level anyway. It's not about any certain nonprofit. Seems to me, the more I look into it, this county is really almost like it's got a cathedral of nonprofits built here. They're all overlapping, it seems to me. And the county sits, and maybe this is common in all counties, that county employees are also sitting on all these boards. So I have a second residence here in Michigan, and I'm a different county. So I think I'm going to go up there and kind of do a little bit of looking to see how that county's set up, if it's any different from here. And my interest more is on this nonprofit cathedral that seems to have been built, and where did it come from? That's what I'm asking. But though, if there is such a coordinating council and there is any paperwork on it, here is my email, and maybe somebody else can get back to me.
I'm not sure what
it's going to be out of this here. This is supposed, I didn't see anything on this council on open source. That's what I'm looking for.
You're looking for information on the Human Services Coordinating Council?
Yes. Is that an entity?
It's just a group of nonprofit leaders who come together to make sure that we're coordinating, right? Yeah. And if I could just jump in here, Terry, and maybe I'm misunderstanding your use of cathedral as an example.
Well, it's just that something seems like it's been built. Yeah, that's, I guess, where I'm going back. And I'm not saying it's current. Yeah. I'm saying somewhere along the line, something got built here. Yeah. I'm just wondering if it was built.
What's built is relationships, I would say. And we work very hard to maintain those relationships with our nonprofit partners in government as well.
Right.
Because
So
we
what's
know that
being
we can-
built is something the county, I'm just talking as a way, we're just citizens of the county. We're public. We're private business. I've had a private business in this county, 3 of them. And my family, all private businesses, all their own businesses. And we're just kind of seems like why this got set up. I don't think people out there know. They just don't know.
No, and Terry, I'm gonna give you the 5,000 foot view of it.
We don't understand how this is.
The key word is collaboration. Okay, in Ottawa County, you're gonna find collaboration starting with the Sheriff's Department, with the Strategic Controls Department over there, working with different townships. You know, it all started with, hey, we need help here. Yeah, we have that service. We can help you. And it just kept growing, Terry.
That's what I'm thinking.
It's not something, we're very fiscally conservative, okay?
Right.
And if we can get a nonprofit that's willing to help out with that instead of paying money for it, that's a little bit. Now, Patrick has spoke. That's a good example of collaboration across the county. So it's maybe some of our nature.
Right. My concern again is that we have this ARPA money that has come into the county. As far as I know, the amount of money that comes into a county with ARPA funds is delegated of all the people that are in the county. It's the residents of the county, the amount of residents, and that's the amount of money that somehow I came up here and spoke. I didn't want the money at all. And if you were going to do the money, give it back to the people that you shut down. Give it maybe over to community health or wonderful thing over here with the hearing. And you've got 2 years of kids that are being passed through. Who knows what they're learning about math or reading or anything. These are years these children don't know. And they continue coming through. I don't mean to speak as a frustrated person, but I never even thought that this is what has been set up as a business owner. Never even thought.
If I'm, and maybe now, because up until you just spoke right now, I really wasn't sure what your concern was, to be honest with you. If your concern is how that ARPA funds that the county is,
well, that's just the end result. I spoke with someone here yesterday too about, you know, my daughter waiting 5 years on a list. Her daughter is, my granddaughter is 23 years old. She's been on a list for Harbor House for 5 years. That's a need in our community. That's a need that's not getting addressed. We have a huge cathedral of nonprofits going on here, and I know that on Community Spoke, Harbor House is there. Do they have any combination, any kind of anything that they have a plan to do more of this type housing? I said, we have Ottawa Area Center, great school district. My granddaughter is going to age out of that system in 3 years. Where's she going? Like my daughter said, she's been changing diapers for 23 years. That daughter is a 1-year-old, her size. People need help. I guess it's a frustrating thing. And being a business owner in a county, I never thought. I always just thought everybody was kind of doing what was best for everyone. So that's it. I'm just kind of, that's all I'm saying. And now we've got this huge pot of money. And I said to the person that was sitting next to me yesterday, the Parks and whatever person, if we pass that by and don't get housing, that's going to be the last time. We could have I said we could have a Mayo Clinic right here with our school systems, our housing. We know people that have moved into the area for it. I'm sorry, it's too long.
Thank you, and I can just say in general with ARPA funds is, you know, the county is receiving about 57 million of that. We've set up a task force composed of not only governmental people, but nonprofits. And I can tell you there are numerous, and I've used this analogy a lot, you win the lottery and all of a sudden family members that you never knew come out of the woodwork saying, I want your money. And we've received a lot of demands. We haven't decided yet how to spend that, you know, but we have set up 5 general categories of spending that.
I get that because we're watching the website and we're going to just stay engaged to see what happens.
So, and one of those categories is human service needs, and how best to use that money for transformational type of projects. We don't know what that is yet, because I mean, I'm just saying. I'm not denying that that's not a need.
But it's actually a tangible need that you can actually see and put your hands on. It's not more websites, it's not more surveys, it's not more of all this stuff. It's something tangible, you can see it. That's what I'm asking for.
Right, and we want to have transformational projects on those type of tangible needs, but that's something that can be self-sustaining over time, because this money is a one-time money. So if this were a program, and I'm making this up completely, where you now need to hire 15 people to run it on an ongoing basis, that's harder to do. Because
but then
when the money runs out.
But then maybe get in contact with somebody like Harbor House. They do sit there, ask them. It would be a good direction. I mean, just let us know as a public that it's been at least discussed maybe with them. I understand it's a one-time deal. You'd have to have the resources to pull it through.
No, and in each of those categories, for example, human service needs, they are reaching out. We call them the bucket manager, but they will be reaching out to all the different organizations and saying, hey, trying to identify projects. And some may be along those lines, some will be on other lines, frankly.
Exactly. No, I totally understand. Thank you. Thank you. Thank you for your listening.
Okay, Randy and Kyle, I'm going to wrap it up. Public comment. Wait a minute. We got one more.
I'm going to come up under public comment just because it was brought up about the Lyme disease. And I had remembered reading through our annual report for the health department. I had to look it up to make sure because it almost seems unbelievable. Concerning Lyme disease, the number of cases went up 180% since 2020. And that was a result of 28 cases. So definitely appreciating the work that we're able to do through the grants. And hopefully that'll continue, as well as getting the word out to people that this is a real concern and it's a life-changing concern.
Well, and I know my grandson that got it, they spent in 2020, they spent a lot of time at the county parks.
A lot of people did.
And more people did. So that going up, I kind of see that. But anyway, thank you, Leslie. Appreciate that. Any other questions? Otherwise, we are adjourned.
Nope, I got nothing.
Take care, everybody.
Thank you.